Now at age 45 it changes again. In all the cells of your body, the way that your body converts food into energy, it's a multi-step process, but one really critical step requires a nutrient called CoEnzyme Q10. People have heard about it.
Sure.
And your body makes CoQ10, so you don't have to worry about it. But after age 45, it's a 17-step process to make it, and you start losing some of those enzymes, and you don't make optimal amounts. So now it's like there's a piston missing in the engine. So you can't make energy at the same rate. People get a little more tired. But on a cellular level, it really affects the heart. So the heart muscle gets a little weaker, can't pump quite with the same force. You don't notice it, you're 45 years old. But slowly over time, the constant decline leads to a weakened heart, it gets more enlarged, and that leads to congestive heart failure in many cases. 75% of people with congestive heart failure have a CoQ10 deficiency, and some people respond if you give them CoQ10. So why are you waiting for the congestive heart failure? At age 45, you put in a small dose, 30 milligrams with some hawthorn, and you can optimize your cellular energy and keep that going at a level that'll give you a functional
That's amazing. And again, if your dad had a heart attack when he was 50, you just think, oh, it's coming down the pike. Hopefully make some lifestyle changes that would help, but something that simple is looking at what your body isn't manufacturing anymore.
Right. Now for that, I asked that question on naturalhealthtest.com. I said, did anyone in any first degree relative have a heart attack before the age of 60? That would imply that you've got some genetic risk that may be sitting there like a bigger time bomb for you. So that it could be that you don't clear cholesterol from the bloodstream really well because for genetic reasons. And so your cholesterol's high, you can clog it. You can get heart disease for other reasons besides CoQ10. That's what I'm alluding to.
Yeah.
And so as I say to people, find out what your cholesterol level is. If it's not below 3.9 millimoles per liter, you have to get it down to that level. Because if you get it there, the chances of you having a heart attack are very slim. So I teach them how to do that with diet and exercise and some nutritional supplement fiber powders and even the combination of a couple of herbal things that can bring it down before you start on the heavy statin drugs, because I think they're dangerous, quite frankly.
Well, I wondered, because it seems like there are so many medications that are prescribed fairly routinely for things like cholesterol and high blood pressure especially, that they may be working a good purpose, but once you're on them, you see people afraid to not take them, and then maybe not pay attention to what does the drug do to other aspects of your body?
Well, we're starting to find out that statin drugs can do serious liver damage. So if you're on them, you have to have your blood checked every 3 months to see if there's any liver damage showing up. You can develop rhabdomyolysis, which is a life-threatening disease because it breaks down your protein structure and lodges in the kidney and clogs them up so you can't filter things normally. You die of kidney failure. So that if you have muscle pain and you're on it, that's probably what's happening to you, which happens in up to 30% of cases, according to some cardiologist reports. So I don't think that's the first thing you do. So when I talk to doctors about that, I say, why do you write that prescription so fast when you know that diet and exercise, lifestyle, and some natural supplements can actually bring the patient down to a normal level in 90% of cases, not just...
That's pretty huge.
90, documented by the Framingham Heart Study. And they say, because people aren't going to do it. I say, why don't you give them a chance to make an informed decision?
Yeah.
And then if they choose not to, put them on the drug. But a lot of people will say, I didn't know I could do it myself, and I'm a bit afraid of that drug now that I know the potential consequences. It's like smoking. You see someone smoking, and they know the risks. But not everybody knows the risk of a faulty dietary pattern. So I'm trying to help them understand that those dietary behaviors are just as important as smoking risk factors when it comes to cancer and heart disease.
Question on the example used with the coenzyme Q10 and the heart. If somebody does experience a heart challenge, having not taken the supplement, is it likely then that as long as, it's not a serious thing, but they experience a heart challenge, then is it likely that supplementation could undo any damage?
Look at the work of Carl Folkers at the University of Texas in Austin, who teaches at the medical school there. He discovered vitamin B12 in 1948. We had a conversation with him on the phone. He's done most of the research on coenzyme Q10. His studies demonstrate with cardiologists in the Texas area that you take somebody that has congestive heart failure and other types of cardiomyopathies, other types of heart disease, and you give them CoQ10 at fairly high doses, because now it's therapeutic, not just preventative, and most of those patients, their heart performance improves, they can be taken off of some of their medications. So you say, then why isn't this standard procedure? And I'll tell you why it isn't. Because medical doctors, and I'm not knocking them because
No.
they do a great job, God love them, it's a tough job, and they're busy like crazy.
Yeah.
But most of their education is manipulated and influenced strongly by pharmaceutical
Sure.
companies, and the journals are affected the same way. They're not exposed to it, and if they're not exposed to it, they don't think it's real. But there's a whole body of science, a whole discipline out there called independent scientific research and journals that are full of these reports that they just don't see.